Welcome to part 2B of Module 7 and welcome to our physiotherapy clinic. This afternoon I'll be demonstrating two types of exercise. The first one being the exercises illustrated in the research paper that you had to read in part 2A by Tyler and his collaborators. So I'll be demonstrating figure A to figure E, exercises that were proven to be effective in treating tennis elbow. Part B, I'll be showing you a very simple exercise that the patient can do at home with one simple weight that will help to isolate the wrist extensor in an eccentric contraction. So first off, we need what we call a TheraBand Flex bar, which is a resisted type of exercise bar. If the patient does not have that, we can use anything that can hold a grip. I'm going to be using this for demonstration purposes because it is a little bit bigger, easier for you to see. Standard procedure is standing straight, elbow at 90 degrees, shoulder in neutral. Part A, the affected arm or the affected elbow will be in a full extension. Part B, good hand will come and twist further into extension, maintaining this stretch. Part C will have the arm forward, and we want to maintain again the full extension. And with the good hand, we want to resist the motion. So we want to passively bring it back into an extension with the good hand. Resist the extension, so we have a lengthened position of the wrist extensor, which is an eccentric contraction. Bring it back with the good hand passively. Resist the movement, so we have an eccentric contraction. And we bring it back passively, so we don't do a concentric exercise to avoid any irritation at the lateral epicondyle. Resist the extension and bring it back into extension. Resist with the good hand and bring it back. And that concludes figure A to figure E. It can get a bit confusing for the patients, as you see, or they might not have the appropriate equipment to do it. So we can do a very simple isolated wrist extensor eccentric contraction with one simple weight. So all you need is 1 pound, 2 pound. You don't want to be using a 20 pound for this. Patient is sitting comfortably, shoulder at neutral, elbow relaxed, arms slightly over the therapeutic table to be able to do a full flexion at the end of the exercise. Small weight comes into here. We want to passively bring it up. So a concentric exercise, the muscle is shortened. So we want to resist as the muscle lengthens. Bring it back passively. Resist the return. Bring it back passively. So we don't want to concentrically contract the wrist extensor in hopes of reducing the inflammation and the micro tears here at the lateral epicondyle. Resist the return. Bring it passively. Resist the motion. Bring it passively. And you want to go down at a speed of 1, 2, 3, 4, and 5. Resist or return. And down passively for a count of 10. And that concludes part 2B of this week's online module.